Welcome to the office.
Thank you.
I have you in today for a complete abdominal assessment.
Yes, that's correct.
Okay, so it looks like you're just in for an annual. I didn't see any notes that there was anything specific of concern.
No.
Okay, perfect. So I will go ahead and get started. I do have quite a few things we're going to go over today, just making sure that everything with your abdominal area is functioning correctly. So I'll have a look at your gastrointestinal tract, palpate around your organs, feel around your rib cage, do some respiratory assessments, and then just an overall inspection of your skin. I do already, just upon visual inspection, see that you have a couple moles, so those are things that I will be looking at just to make sure there's nothing concerning happening, okay?
Okay, sounds great. Thank you.
All right. Okay, so let's go ahead and get started. I like to start all my inspections with just a visual examination, so you're welcome to just lie, relax. Are you comfortable in the position you're in?
Yes, thank you.
Okay. So I'm just going to be using a Penlight to perform a visual inspection, so I will be coming just a tad closer to you here so that I can have a look. Now, starting by shining my Penlight over the abdominal cavity. Just like to start by having a look at the overall skin texture, for any abnormalities externally. Don't see any signs of patchiness or flakiness, certainly no indications of dermatitis or psoriasis. No bumpiness that could indicate eczema. I do see just a couple freckles here and there. Looks like you have a couple moles as well, so there's something.
I had a couple removed as well right here.
Did you? Okay, so I do see a scar there. Were those biopsied by chance?
Yes, they were benign.
Okay, good. So it's good that you have them looked at, but that can be a cause for concern for any secondary moles that you have. Obviously, we'd want to keep a close eye on those. So the ones that I see here do look okay. This one is just a tad darker, but the borders are circular, and I'm not noting any raising above the surface of the skin. So I will have a closer look at that with my magnifying glass in just a few. So as you lay here, relax, I'm just going to have a look at your respirations, looking at the rise and fall of the abdominal cavity. Just notating any abnormalities I may see bilaterally here, but so far everything looks okay. So I'm going to have you take a big deep breath in. Good, and go ahead and release and hold. And then we'll do that one more time. Good, to go ahead and release and hold. Perfect, okay, so that looks good. So I am going to go ahead and have a look at those moles. Of course, okay. Alright, so I just have a lighted tool here that will allow me to have a much closer look. So, seeing one freckle here. That does look perfectly fine. Okay. Some scar tissue there where it looks like you had one of the moles removed. Does appear to have healed properly. Did you have any issues during the healing process? No signs of infection or anything? Okay. Now this one here is the biggest and potentially the most concerning, but from what I can see, the margins are fairly circular. No patchiness or discoloration. Slightly raised above the surface of the skin, but not so much that I would say it's of concern. And just a couple freckles here. Now, our abdomens are not usually particularly exposed to the sun, but if you ever have a day where you're out and about at the beach or something, are you applying sunscreen?
Yes.
Okay.
It's rare that I expose it.
Okay. All right, so I'm just going to use my thermometer gun to perform a couple checks for temperature variation. So I'm just going to hear a clicking sound. This just allows me to test for any areas of concern. If there are areas that are particularly warmer, it could just indicate a sign of underlying infection or inflammation within the organs. So just having a look here at the first quadrant. I'm not noting anything. And lower right quadrant also within normal limits. And directly above the pelvic bone, also not noting anything here. Good. All right, so at this point I'm going to go ahead and place a pair of gloves on. I'll be starting with a bit of manual palpation, so just using my hands to feel around. First I'll do more superficial palpation and then I'll go in a bit deeper and feel for your organs. Okay, apologize if my hands are just a touch cold. So I'm going to start here, the border of the chest wall, just above the rib cage. So just feeling for any signs of distension here at the sternum. Okay, so now I'm going to palpate the ribs individually. Feeling for any nodules. Do some bilateral comparison here, looking for any signs of distension at the top of the rib cage. Just assessing the perimeter of the ribs here. Good. Okay. Starting with a bit of superficial palpation at the lower quadrant, so just using a flat motion to feel around. At this point, just feeling for any signs of distension or bloating at the abdominal cavity. Okay, so I'm just going to feel at the pelvic bone. So I'm going to do a bit of a deeper palpation here, now feeling for your organs. So again, just a flat motion here, feeling for any signs of distension, any abnormal lumps below the skin. organs are not always palpable, but if they're inflamed, then I can sometimes feel a little more distension than normal, but so far everything feels okay. So I'm going to palpate directly across the middle of your abdomen. And lastly, directly around the umbilicus, looking for any signs of umbilical hernia. You are fairly active, so just ensuring that there's no signs of strain at the core. A lot of times people will have a hernia and not even really be aware of it. That does look okay. I'm going to move on to taking a couple measurements here. So starting with just some base measurements for symmetry. So I'll just be measuring bilaterally, ensuring that there's no significant difference from one side to the other. So I'm going to use your top as a marker, stopping parallel to the pelvic bone. We're about 9 3/4 here on the right side. And about even on the left there. Breastbone to the base of the pelvic bone is about 10 inches. And 9 inches at the rib cage. Okay. Looks good. So I'm just going to use this tool here to have a look at these moles. So I just want to see this one here. About 10 millimeters. How long ago did you have those moles removed?
5 years ago.
Okay, so it's been quite a while. Have you since followed up with your regular dermatologist?
I go every 2 years.
Okay, very good. So just notating here, we'll say about 11 millimeters in total. These ones are about 4. Okay. So we're just going to measure the natural distension of the rib cage here, just checking for symmetry. Okay, so have a fairly short torso. So some things to look out for with a short statue, short torso. I tend to find that my patients become more easily bloated or just a fuller feeling as your intestines are just kind of squished together more so than if you had a much longer torso. So it's just something to be cognizant of. You might feel some discomfort if you're overeating or eating too fast. I'm not seeing any signs of abnormality here. So just measuring the curvature here as well. And we're right about even here at the center, so that's very good. This next tool is very cold, so just to give you a warning, I'm just going to measure you one more time with my calipers, and this just allows me to get a more precise idea of your bone structure, so I can use this to measure along the rib cage, looking for the natural widening as we come towards the lower quadrant here, which is present. So midsection here, I would say, is about even. So measuring for symmetry at the umbilicus, just ensuring that we are fairly even side to side as well as from top to bottom, not noting any abnormality there. Also not seeing any signs of muscle wasting at the core. No abnormal dips. Okay. So lastly, just measuring right at the pelvic bone. Looking for any signs of displacement or possible dislocation. Now, obviously you would likely know or feel quite a bit of pain, but I would just like to make sure. I'm going to move on to some percussion. So I'm just going to start with the manual percussion. You're going to feel a gentle tap. First at the bony prominence, tapping along the rib cage. I'm going to repeat my percussions here. I have a very small reflex hammer. It's not going to cause you any pain. You're just going to feel a light tapping. Gentle percussion just along the umbilicus, testing for any audible abnormalities here, any sounds of hollowness. Also percussing for any abnormal rigidity. I'm going to go back in with the secondary palpation. Now that I've manipulated the abdominal cavity and things have moved around a little bit, I like to go back in and see if there's anything I could have missed along both the surface of the skin and upon deeper palpation. So starting off superficially, feeling the skin texture. Not feeling any abnormal roughness. Slight manipulation of the epidermis, looking for any abnormality in skin turgor. Checking your skin's elasticity. You're obviously fairly young, so collagen production is still intact. I'm not noting any sagging of the skin or any abnormal wrinkling. Okay, so secondary palpation, slightly deeper, firmer pressure. Really palpating along the lower quadrant here, feeling for your intestines. Alright, and I'm going to go ahead and move on now. I'm going to do a test for bone conduction, so at this point you don't have to do anything just yet. I'm just testing your body's natural response to vibration when applied directly to the bony prominence. Now I'm going to ask you if you can feel vibration here. Good. And if you feel vibration here. Good. And here at the pelvic bone. And here on the left side. Very good. So I'm going to apply a very cold object to the surface of the skin. You don't have to respond with anything just yet. I'm going to test your abdominal reflexes. So you have several nerve endings that should cause you to flex just slightly when you feel something that's fairly cold. So just try to relax for me. Very good. So seeing healthy reactivity at the center of the abdomen. Very good. I apologize. I know it can be fairly ticklish. Very healthy abdominal reflex there. Going to test that one more time with a sharper, more distinct object. So again, we should see a flexing of the abdomen there, which is present. So it just indicates a healthy neurological response. Slightly diminished here above the umbilicus, but certainly present below, so that's okay. All right, Hannah, so we are going to go ahead and move on to the next portion of your examination, which is a test for sensory perception. Now, kind of secondary to the first test that we performed, I am going to apply certain tactile stimulation to the abdominal cavity, and I'd like you to indicate if you can feel it. So this first one, you are going to feel kind of a gentle puff of air. Now, I'm not testing auditory response, so try not to respond to the sound, more so the feeling. So do you feel air here? Good. So you can either indicate verbally or just shake your head yes if you feel it. Good. Very good. Very good. So you did very well with that. And following up, I'm going to test for soft sensation. So just to give you an example here, you are going to feel a very soft kind of cotton wisp, and again, just indicate if you can feel it. Very good. So I'm going to follow that up with a very sharp sensation. Now, this wheel is a very distinct feeling. It won't cause you any pain, but it is going to feel very sharp. So just giving you an example here. Can you feel that this is sharp? Mm-hmm. Okay. You feel that? Mm-hmm. Good. Sure. Good. Sharp. Sure. Good. Sure. Good. So I'm just going to do a variation now of the sharp and the soft or dull. So just again, this was the soft or dull, and this is the sharp. Soft. Sharp. Soft. Soft. Sharp. 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 You don't have to respond at this point with whether or not you can feel it. I'm going to test for bilateral sensation response. So if I trace this along this side here, can you tell me if that feels the same as this side here? And here at the center of the abdomen. Any difference here?
No difference.
And if I come across any areas of numbness or tingling?
No.
No. Good. Okay. And all along this should all feel fairly similar.
It does.
Very good. All right. So I'm going to finish up with just one last look, ensuring that there's nothing I could have overlooked. So just having a secondary look with my Penlight. I didn't see any notes about any issues with indigestion or lack of fiber of the diet, any signs of constipation. Are you having regular bowel movements?
Yes, I am.
Okay. Do you follow any sort of special diet? Eat generally healthy, lots of fruits and vegetables, preferably raw?
Yes, I do.
Okay, very good. So obviously very important to get lots of fiber in the diet, especially with my younger patients. We are seeing an uptick in colon cancer, so certainly important to get your fiber in. Make sure you're drinking plenty of water. Obviously remaining active is going to aid in digestion. It does sound like you're just a touch hungry, but good news is we are all done with our examination, so you are welcome to grab a snack on your way out of the office, okay?
Thank you.
You're welcome. I will put all your notes into your file, and then obviously we'd like to see you back in a year just for a follow-up exam.
That's great. Thank you.
Thank you. Get home safely.